My name is Terry Evans, and I want to tell you a story about my bouts of autoimmune hemolytic anemia. First, to give you some background, in 2000 I was diagnosed with chronic lymphocytic leukemia. And even though it's an indolent disease that sometimes takes a long time to need treatment and sometimes never needs treatment, in 2007, I had progressed enough that I required treatment. So I started treatment in October of 2007. And as soon as I started treatment, I've developed a complication in my red blood cells, in my hemoglobin. And the doctor at the time who was treating me decided that the best course of action for me was to give me transfusions of red packed blood cells. And over the course of several weeks, this was his solution to the problem of my dropping hemoglobin. So my wife, who happens to be a nurse, asked the doctor if this could be a condition called autoimmune hemolytic anemia, because she had seen this in her years of practice and was familiar with the condition. And the doctor replied that, well, although it was possible, they had run a test and determined that it was not the case. And so, just on the side of caution, she asked if we could see the test. And the doctor said, sure, he was going to go get it. So he left the office and he went out. About 5 minutes later, he came back in and he said, well, I'm certain we ran the test, but I can't find it. So this really gave us pause. And so my wife immediately had gotten on the phone when we got home and contacted a doctor that specialized in chronic lymphocytic leukemia and gave to them my blood numbers over the past 2 months. And their response to her was, how soon can he come in and see us? So that was on a Thursday. We were able to get an appointment on a Tuesday. So we went down and saw the doctor, and I was sitting in the waiting room waiting for him to come in, and it had been quite a while. And I finally asked the nurse, what's my doctor doing? Is he going to come in here? And I was very fatigued at this point in time. I was really kind of at the end of my patience in terms of feeling bad. I couldn't drive anymore. I could hardly walk up a flight of stairs once a day. It was just too exhausting. When I took a shower, I had to actually sit down on the step in the shower and dry myself off because I couldn't stand there that long. So finally, the doctor came in, and after the nurse had told me that he had been looking at my blood under a microscope, and he said, well, I can confirm that you do have autoimmune hemolytic anemia. And right now, I hope you don't have any plans. And I said, well, tomorrow is my 60th birthday. And he said, you'll be spending it in the hospital. And he said, right now your hemoglobin is 4.6. And after about 6, the body starts shutting down and moving red blood cells to your critical organs in your body. And he said, I'm really glad that you came in to see me because within 48 hours, you would have probably died from cardiac arrest. So they proceeded to put me in a wheelchair and take me to the hospital that was associated to the cancer center where I was at. And they wound up transfusing me with 4 units of blood this time, as well as steroids, to get my hemoglobin up to a level where they could release me from the hospital. And luckily for me, I was able to get out of the hospital that afternoon, but he wanted me to start on a course of prednisone. And he said, I want your blood checked every 2 to 3 days. And if need be, we'll give you additional transfusions. But he thought that the prednisone would at least make me stable. So I went on a 2-month regimen of prednisone, and it did keep my hemoglobin levels stable. And so we decided to taper off the prednisone, stop it. And I was good for about 4 months. But at the end of 4 months, the autoimmune hemolytic anemia came back again. So we said, well, that worked. So why don't we try it one more time? So we tried another course of steroids, again for a couple of months. But this time I only got 2 months reprieve out of it. So he says, I really think that in this case, your chronic lymphocytic leukemia is actually causing the wAIHA. So he says, why don't we do a treatment for that and see if by controlling the CLL, we could also control the wAIHA. So I agreed. And he started me on a treatment of a monoclonal antibody, Rituxan, and high-dose methylprednisolone, which is like steroids on steroids. It's an infusion that you get, and it's extremely potent, and it drives all the cells out of the bloodstream, out of the lymph nodes into the bloodstream, and where they can be killed by the monoclonal antibody. So this treatment, which actually lasted about 4 months, actually worked. And it not only controlled my CLL, but it also controlled the autoimmune hemolytic anemia. And I got 13 months out of it before we had to start it again. So he said, well, we got 13 months. Why don't we try that again one more time? So we tried it again one more time. And it brought the CLL under control as well as the anemia. But I only got 4 months out of it this time. So he says, I think we're going to have to change treatments, and let's see if that works. So I happened to go on a clinical trial for chronic lymphocytic leukemia. It included a monoclonal antibody, but it also included one more drug, which was a chemotherapy, and another drug, which was a targeted therapy. And I was on this treatment for just about 6 months. And at the end of that treatment, we decided to stop because I had some complications. But my anemia and my CLL were both under control when I stopped. And that was back in 2011. And since that time, my hemoglobin has never dropped after that. So in my particular case, it seems like that the chronic lymphocytic leukemia was the one driving the autoimmune hemolytic anemia. And these types of cytopenias do happen for patients with leukemia in about 5 to 10% of cases, and I was one of the lucky ones. But thankfully, after that, I've had no more episodes, and it's been under control since then. So thank you very much for listening.